Hello and welcome to Pulse Check with Archer Nursing, where nursing comes to life. In this podcast, you give us 15 minutes of your day, and we'll take one complicated nursing topic and make it easy. Ready for nursing to be fun? I'm Morgan, and today we're talking all about staying organized during nursing school. We have started our semesters. A lot of us are starting to get into thick of it now, and it just gets more challenging, if you ask me, as time goes on. So we have a special guest on with us today to help us really dive into how we get ourselves organized and keep going throughout this semester. So a big welcome to Dr. Jennifer Bonner. Thanks for being here, Jennifer.
Thank you for having me, Morgan. I'm so excited to be here.
Yay, it's going to be a great episode. So for those of you who don't already know Jennifer or Dr. Bonner, she is our wonderful manager of nursing services. I know a lot of you have already studied with her, but Jennifer, for those who don't already know you, tell us a little bit about who you are, your nursing background and journey, what you do at Archer now, and your role overall.
Sure. So I am just Jennifer. I'm just Jennifer. So I started out pre-med. My plan was I was going to go to med school. I was going to be an anesthesiologist. And then life took a little bit of a turn when I met my now husband and we started talking about what is life going to look like down the road. And so I really enjoyed that time that I had with my nurse practitioners, just generally is who I used in the medical world. And I love the time that we got to sit and the time that was spent and the quality over the time that we were together. And so I decided to take a little detour and went to nursing school. And I graduated in 2009 and then jumped right into a master's of family practice program at University of Cincinnati. And then we unexpectedly found ourselves unexpectedly expecting. And I realized during that time that there was something special about the labor and delivery nurses. They were they were quite amazing. They had quite the job, but they were so special to me. And even to this day, on the date of my kiddos' birthdays, I always think back to those women and how
sweet.
just lovely they were and how they met me in my time of need. And so I actually had one of the physicians had been a nurse before. And she said, you know what? I want something better for my patients. And so she went back to med school to become an OB-GYN. And I thought, you know what? I don't really feel that pull to become an OB, but I really love this. So I went back to school to become a nurse midwife. And I finished that and then finished up my DNP. And so here I am. I spent probably about 4 years at the bedside as a certified nurse midwife. I functioned as a nurse practitioner. I was in the clinic Monday through Friday, 9 to 5, and enjoyed just the time that I was able to spend with women of all ages, from adolescence all the way to menopause and beyond. So I fell in love with that and then felt a pull towards education, finding that I had students that were coming to me as needing a preceptor, whether that was a medical student or a PA or a nursing student, and them just saying, you know what, nobody will take me. I'm really struggling with this. And so I felt that pull towards education. And so I started teaching at a community college and then found Archer, became a tutor for quite a while, tutoring nursing students. And now I serve as the manager of nursing services and I absolutely love what I do. I love the aha moments that I get to be a part of. And just this morning, I was teaching a live case and where somebody popped on to say, because of the support I received through Archer Review, I was successful on my NCLEX. And that just makes my heart swell.
Those were the best. Yes. It's always such a happy moment. So rewarding.
For sure.
So we talk a lot, you and I and our whole team here at Archer, about setting our students up for success. What tools can we give them so that they're not struggling from day one? Because I don't know about you, nursing school was not like a happy time in my life. I was like up to here with stress and anxiety the whole time. If I could go back and like tell myself, calm down, do X, Y, and Z, get your ducks in a row, I probably would have been a lot better off. And I know both you and I really want to pass that off to our students. So I want to start us off talking about just overall how we set ourselves up for success when it comes to getting organized. What's kind of the first step? Sometimes that's the hardest thing. How do we get started? especially at the beginning of a semester.
For sure. And that is always difficult. Anytime we start a new project, whether that's school or home remodeling, or maybe it's a family vacation. Recently, we were just on one of those. And when you get ready to start those big projects, you're like, oh, wait a minute. I probably need to think through that. So I think the first thing that I tend to do is realize, hey, there's something coming up. Recognizing that I have something that's coming. So with nursing school, okay, when does it start? When am I expected to be back in the classroom? Knowing those dates. And if recently I saw on Facebook that you had just put out where you were going through our nursing toolkit, which is an amazing first step. If you have not seen that, go check it out. Just breaking down, how do we even start with this info? What do I do with it? Because if you're anything like me, I am the kid that I waited with bated breath for my elementary class list to come out, and the supplies list. I was that girl. Even into nursing school, like, what is my class schedule going to look like? Who is going to be teaching it? That kind of thing. Clinicals. So starting with those dates and putting them on my calendar. Yeah. I am the one that buys the really thick planners at Michael's when they go on sale around Black Friday, that has all the stickers, all the things. Because if I don't like it, I'm not going to use it, is the thing. Recently, my husband and we started using our iPhones. We use our calendar in there so that we can keep up with, hey, what's going on? Who has a doctor's appointment? Which kid is playing this game where? And so that can be helpful, especially if you're sharing a calendar with family and friends, so they know what needs to happen, where you're going to be, and when you're going to be there. So my first step is recognizing that there is something coming up, and then plotting those out, whatever they look like. My next step is I put everything in a different color.
All right.
Y'all, I have a serious pen problem. If I could show you, I have a stack of pens that are probably this big, probably about 10 centimeters for those of you that are labor and delivery hopefuls. But I have one for each subject. So maybe cardiac I put in red, labor and delivery I might put in pink or purple. So I know what goes where, and then I have a little bit of a key.
Nice.
So those are my first steps when you're just getting started, because we don't want to do everything on one day, because that gets overwhelming. If you think about anyone who's been on maybe a weight loss journey, you're like, okay, I need to exercise 5 days a week for at least 45 minutes. I need to drink glasses of water a day or more. I need to not eat bread. I need to not eat sugar. But if we tend to do them all in one day, we get overwhelmed, we get bombarded, and then we set ourselves up for a failure.
You're so true. Something you just said that absolutely resonated with me was, if I don't like it, if I don't enjoy it, I'm not going to end up using it. Jennifer, I cannot tell you how many planners I have, stress bought at the store that have ended up in the garbage can unused.
Oh, yes.
Because they weren't functional. They weren't in a layout that worked for me. By the end of nursing school, I knew exactly the layout for the planner that I needed. And very similar to you, I started with the end in mind. What are my priorities for the week? What are the big things that have to get done? And how do I backward plan from there to do a little bit each day so I can accomplish that goal in the long run?
For sure. I am one that I tend to be very frugal. If I could buy a planner at Goodwill, I would do that. Just not to spend the money. But I've realized that when I'm going through those areas where it's a little less money to be spent, I don't like it as much. And so I tend to spend a little bit more on those pretty calendars, on those thick calendars. But yeah, if I don't like it, I'm not going to use it. And then I've kind of defeated that purpose.
You've defeated the purpose. Absolutely. Yeah. So it's funny, you've almost answered my next question. I was going to ask you, are you digital? Are you paper? What do you prefer? And it sounds like maybe you use a little bit of both.
I do. I use a little bit of both. So to communicate to other people where I'm going to be, when I'm going to be there, if I have something big going on, I use my digital calendar. And sometimes hear me out. I know this goes against our nursing mantra. Sometimes I double chart it. I put it in both places just because I'm the type of girl that I make a list just to check it off. So sometimes I'm in therapy for that. It's fine. But yes, sometimes it's helpful to know, okay, this has been communicated. Yeah. But I also have this for my peace of mind. So I like to use both, but they're for different things. So for like if there's a big deadline coming up, I need to have something submitted by a particular time, I'll put a reminder in my phone that says, hey, chop, chop. You've got 30 minutes before this is due. If you don't have it ready, you might want to begin getting that ready
Come
to
on.
go. Okay, so maybe not 30 minutes, probably a little
Maybe
more,
a little
but
more wiggle
giving
room.
myself some little reminders
Yeah.
of, hey, if this is a bigger project, you probably should have started this by this time.
Yeah. Yeah. Okay. So great point. We've got big projects. Nursing students also have lots of little things, not even little things. They're managing, deadlines for course assignments. We've got exams. We also have clinicals to contend with. So other than color coding, I love the, clinicals are this color, exams are this colors. Realistically, that's a lot of balls in the air. How do we juggle all of that? Any tips for like getting our ducks in a row and just, it's going to be stressful, but maybe making it a little more streamlined?
Yes. So, like I said before, if we look at the big picture and try to focus all at once,
Yeah.
it can be very difficult. It
Yeah.
can be very overwhelming because there are a lot of moving parts.
Totally.
And that's only if you don't have a class that gets canceled for, weather or whatever reason. So I like the idea of the backwards planning, kind of giving me an idea of what's going on this week.
All right.
If I'm being completely honest, there were days in nursing school that I was day by day, like even, okay, what's going on in the morning? And then I will figure out what's going on in the afternoon. Now, there are a lot of moving pieces and a lot of different places that you're supposed to be at. So when I was in undergrad, we did our course learning in one building,
Uh-huh.
but then in the afternoon, we had to cross the campus, go through the hospital, weave our way through. It was a teaching facility in Arkansas. So we made our way through UAMS and over into the VA and then crossed the street over into another building where we had pharmacology.
Oh.
So it was, okay, I know that I have pharmacology this afternoon and I know that I'm here now and I need to be there by the afternoon. But then tomorrow I'm in a different facility. The facility that we were in did not have mental health capability. So we were in a completely different setting, had to navigate across town or maybe into the next town over in order to get there. And so having those things on my radar of knowing, okay, not only is this assignment due, but I have to actually be in a completely different setting. And sometimes that just comes with time, knowing, okay, we're changing. So like this day we're going to start peds and peds is in this area. And then in the next 6 weeks, I'm going to move into mental health or maternity. So having an idea of how that's going to flow, and those things typically will fall in line as we kind of get into that groove.
Yeah.
And I think the other thing to remember is that our instructors have all been exactly where we are.
That's a good point.
I can't tell you how many times I've been in, a teaching opportunity, whether it's the 3-day live or our webinars. You guys haven't checked those out for sure. Come and see what it's all about. But having students going, you just don't understand. But we make ourselves remember, hey, I was here. I remember what it was like studying for those boards. I remember what it was like knowing that I have a clinical tomorrow and I have a paper due tonight. And maybe there wasn't a whole lot of sleep. So reminding ourselves that our instructors are people too. They remember what it was like. Typically, they're going to give us a little bit of grace those first couple days, and giving ourselves some grace too. We're not expected to have it all figured out right now. And we will find that as we begin to practice is that our clients don't expect us to have every single answer. But what they do expect is that we can find it or we can find somebody who will.
That is such sage advice. You absolutely are not meant to know it all right now. And that extends not just to the content itself, but all of these things regarding time management and organization. And, as you're starting off with this semester, if you feel like you're struggling right now, you are not the only one. Everybody is learning with you in real time. Oftentimes, your instructor is included, right? We're all on this journey together. So, right, we are at a really stressful inflection point right now as the semester picks up and things get busier, but you're not the only person feeling that. So I love Jennifer's advice about giving yourself some grace, remembering your instructors have been there too. I always felt like there was such a big difference when my instructor expressed that empathy for like, hey, I've been here, I've been in your shoes. That's a huge thing with us at Archer. We're all nurses. We're all on this journey with you. This journey never stops. One thing I always say is nursing's a team sport. We were absolutely never meant to do this alone. I think it's impossible for us to do this alone, no matter what role you're in. So one bit of advice I would inflect is if you haven't already started building your support system, reaching out to your peers, maybe reaching out to someone a semester ahead of you for advice, your faculty, whoever you're comfortable reaching out to, now is a great time to start building your village and getting that support system because you need these people and they need you too. It goes both ways.
Absolutely. And I think reaching out early
Yeah.
so that we're not to the point where we're completely stressed out to where, I don't know if you're anything like me, Morgan, but when I get stressed, I'm a little more on edge.
Yeah.
I tend to respond in ways that I would not typically, or
Mhm.
I don't intend to. And so building those communities, building those relationships, but also reaching out early, letting people know, being honest, because I've had students that are like, Jennifer, I'm just doing this and this and this, and then this happened, and I've got this going on. Yes, we get it.
Yeah.
Things happen. We may not be under the same circumstances, but we all have some type of stress. I was just reading something the other day that said we're all dealing with something that we can't see. And so I have things going on in my life that Morgan, you'll never
Yeah.
see.
Yeah.
And there are times when I hide it well, but there are other times where, we struggle a little bit. And I think that's part of doing life
Yeah.
together. And you will find there are still people from my cohort of nursing school that I still talk to. We're like, hey, do you remember when this happened? Or, we're able to share those moments with the next generation of nurses that are coming behind us.
Yeah.
Like the situation may be different,
Yeah.
but we are all trying to make it. We're all
Yeah.
trying to figure out how
Yeah.
do I do the best for the patients that I'm going to have? How do I prepare myself in the best way?
Mhm.
But being able to have those honest conversations and reaching out early. So if you're struggling, let somebody know, whether that's your
sure.
instructor, where they can maybe pair you up with
Yeah.
a tutor or another student, because it may not change our situation, but knowing that there's somebody else that feels the same way can make it kind of de-stress
Absolutely.
just a touch.
Absolutely. I think, honestly, our topic today of organization in some ways goes hand in hand with stress. Being well organized can help us reduce our stress. For those of us who maybe are managing anxiety and a high level of stress, what's some advice you have, as the semester ramps up? Penciling in, time for yourself, knowing what you need to manage your own mental health, stress, and anxiety. How do we factor that into this big, messy picture?
Absolutely. I think, recognizing that that is something that we're trying to live with.
Yeah.
Sometimes that can, enhance who we are.
Yeah.
But I think realizing, okay, this is what it is that I'm dealing with.
Yeah.
And being able to voice that. So, for example, just the other day, there was some stressful things going on. And I told my husband, I said, I just need like 20 minutes. Can I just take a walk around the block? So communicating,
Yeah.
hey, I'm struggling a little bit. Here's a way that you can help me. Can we make this happen? And so I think being honest with ourselves, being honest with our village, and also realizing that a lot of students have told me before, Jennifer, I don't feel like I can step away from this in order to replace it with,
Yeah.
whatever that is. I can't leave my home today where I need to be studying for an exam tomorrow in
Right.
order to have some me time.
Yeah.
And you don't always have to.
Mhm.
Right now, you are listening in on our podcast, and you can do that by putting in your ear pods and taking a lap around
Yes.
your block. I work with an amazing educator. If you've never met her, her name is Hiva. She heads up our advanced practice nursing department. And she is one that she's like, I just need to take a minute. I need to walk a minute and then I'll come back. And sometimes that's all we need. A little bit
Yeah.
of vitamin D outside. If that's the season that we're in, I know that every season's a little bit different, but getting that vitamin D, moving our bodies just a little bit. It used to be during our 3-day live, one of our educators would say, hey, I want you to try to do 5 jumping jacks. Now, me doing 5 jumping jacks is not pretty, but it gets my body moving and puts my mind in a different headspace. And sometimes that's all we need in order to come back ready, refreshed,
Yeah.
and powered up to go.
Yeah. I love that. It doesn't have to be this big, huge, daunting task of like, well, I have to
Right.
go to yoga every day and start meditating. And, for a lot of us, that's not a reasonable goal, but I can go walk around the block. I was addicted to listening to my lectures in my AirPods and going for a walk because I felt like I was still studying, I was still being productive, but I was moving my body. And I came back, I was way more focused after even just a 20-minute walk. And honestly, you guys, that was part of the reason for starting Pulse Check was having podcasts that you could feel like I've got literally 7 minutes while I walk across the campus to my next thing. And I totally didn't understand heart failure yesterday. So I'm just gonna put Morgan in my earbuds and we're gonna listen while we walk. And it does, it gets you moving, it sends blood flow to your brain. There's something different about that when you're in motion. It was a huge game changer for me.
Oh, absolutely. And I think finding what works for you.
Yeah.
Occasionally, well, not occasionally, most of the time when I meet with a student that explains they have anxiety, they feel like they're alone. Again,
Yeah.
like I'm completely on an island, nobody else. But I would say more times than not, we're struggling with some level. And so I don't want to diminish the idea of seeking out your medical provider and having those conversations in case there's something deeper or something else that they can recommend is also important.
Very, very true. All right. I have one more question before we move into our closing segment. Can you share any example of maybe some sort of organizational mistake that you see students make? Or maybe something you have learned from experience of, a common pitfall, something that as the semester ramps up, we want to learn from and shift away from.
Sure. So when I was in nursing school, I was the one that printed off all of my lectures. I had all of the PowerPoints in paper form. I need to touch them. I need to write on them. I need to highlight them. I need to scratch things out. And so if that's you, I don't want you living like my son does out of his backpack, where he pulls his papers out and they're crumpled and maybe chocolate milk. Maybe it's not chocolate milk. Maybe it's coffee or another beverage of your choice. But having things in order so that I'm not last minute trying to scrounge going, oh, I know it's in here somewhere. And you're kind of like the Mary Poppins effect where everything is coming out of the bag that you're like, hey, where did that pretzel come from? I don't even remember having pretzels. So having everything in order where you can say, okay, whether that's a file folder of, okay, this is my paperwork for clinical this day. This is my paperwork for clinical peds.
Yeah.
Also, if you're somebody who does not prefer to print out your lectures, we can still be friends, totally fine. But again, having them organized in your computer where this is my peds folder, this is my OB folder, because there's nothing like a last minute, we're going to go through some information. You're like, well, where the pants is that? Where is that PowerPoint? I don't even remember. And going through them often. So a lot of times when I was in class, I would take the notes and I'm like, great, we're good till the day before the test. I'm good. I wrote it down instead of going back and reviewing it. So there's a lot of different times throughout the day where I will say I'm too busy for fill in the blank. But you know what? The other day I was in the drive-thru trying to get some lemonade at Chick-fil-A and it was quite the line. And I had time to review whatever it was. I can grab some flashcards.
True.
But if I don't know where they are, it's going to not give me that benefit of the time that I just found.
Yeah.
So I guess I would say organization, whatever that looks like for you. If you are a one that has it electronically, one in paper form, put those together where you know where they are and you can find them.
Yeah, a place for everything and everything in its place. I love that.
Its place.
It'll help you maximize your time, use it more efficiently. So, even if you're thinking, oh my gosh, the semester's kicked off, I don't have any of these systems in place, it is not too late. Get yourself a planner, start prioritizing, backwards planning so that you work up to those goals. Get those organization systems in place. I love it. And I will just plug that the Archer app makes this super easy because it's already organized for you. And if you need to study super quick in the Chick-fil-A drive-thru, all you have to do is pull out your app. It's ready to go for you, so you don't have to search through a file folder for a PowerPoint from, who knows how long ago. All right, Jennifer, we asked everybody what their number one question for you today was. So we are going to end here with 5 rapid fire questions to you. And we will get your quick organization tip for each. Ready?
I'm ready. Let's do it.
Okay, first question. What is your favorite tool or app for nursing students?
My favorite tool or app. Honestly, it's going to be my Google Calendar.
Love it.
That's where everything lives. I can color code it in there, so it gets a little bit of that OCD-ness for me.
I love
So,
that. I
Google
love a color-coded calendar. That's great.
Plan it out. Yes.
Second question. One thing every nursing student should do each Sunday night.
Sleep. Your day, your week is going to be completely bombarded with things that you know are happening, with things that change. Remember, nursing school is not the only thing on your agenda. You also have families and work and everything else in the mix. So get yourself some rest. Get ready for that week ahead.
I love that. That's amazing. Third question from our listeners. What's the biggest organization mistake that nursing students are making?
Just throwing things wherever they go, whether that's in your computer or in your backpack, whatever that looks like for you, making just a mess of whatever it is that we have, whether it's textbooks or papers, because inevitably somebody's going to need something and you're going to need it pretty quickly, and having to run through the bag to try it.
Totally. Absolutely. Fourth question. Any quick tips for managing clinical paperwork?
I am one, whether you are electronic or you have paper, I'm one that I like a nice binder with those little sticky tabs.
Love it.
They also come in plastic where you can divide them out. So I know pink and I can write on it with a Sharpie or a dry erase marker. So then you're saving money. You can just erase it for the next semester and use it again.
Amazing. All right. Last rapid fire question for Jennifer. Give us a go-to motivational quote or mantra to help us stay on track all semester.
Sure. So I don't remember who said it, but when I was growing up, I was challenged with whether you say you can or you can't, you're right. And so having that in the back of your head, how we talk to ourselves matters. Because if I'm having a conversation with you, Morgan, and you're saying, man, Jennifer, I'm really struggling with my mental health class. I don't understand. I would never say, Morgan, you're so silly. Why would that doesn't matter? Or, you're just, downplaying it. No, I would say, Morgan, I'm really sorry that you're feeling that way. What's making you feel that way? Yeah. Can we sit down and can we talk about it? But for some reason, we will talk to our friends that way, but we talk to ourselves in a completely different manner. And this is no small feat going through nursing school. This is hard work. Yeah. It's dedication, and you are still in it for the long haul. So remember, you can do this. We believe in you here at Archer Review. We're ready to walk alongside you in the tough times, in the valleys, but also in those mountaintops.
Absolutely. I couldn't say it any better. So we'll end right there. Thank you so much for joining us here on Pulse Check, Jennifer, and good luck to all of you going forward in your semester.
Thanks, Morgan. It was a delight talking with you today. Thank you so much.
All right, future nurses, that is a wrap. If you found this pod helpful, I'd love to continue supporting your nursing journey through nursing school, the NCLEX, continuing ed, and beyond. Archer Nursing has you covered with on-demand video lectures, high-yield question banks, live case study reviews, and so much more. We want to help you master tough concepts and make it fun. So join us over at archerreview.com. Follow us on socials at Archer Nursing for more free nursing tips and study resources. Thanks for tuning in to Pulse Check with Archer Nursing. I'm Dr. Morgan Taylor, and I'll see you back next time.